guys can rejoin us and make sure that we're all good. Hi, Archman. Hi, Marlene. Thanks for coming back. So again, my name is Dr. Ann-Louise Lockhart. I'm from a New Day Pediatric Psychology in San Antonio, Texas, and we are celebrating ADHD Awareness Month. And so we want to make sure that we educate you guys, on ADHD and what it looks like for children, teens, and adults so that we know how to address it, how to go about looking at treating and addressing and doing strategies that are important, whether you're a kid, a teen, or an adult. Okay, so we're going to be joined, hopefully, by Dr. Dana Cunningham, and from Black Mental Wellness, and she's going to be talking about it from her perspective in working with schools, with families, with kids, and she is a child psychologist out of Maryland, and she is also the Vice President for Community Outreach and Engagement at Black Mental Wellness. So, you know how this is when it's new and you're new to this technology stuff. All right, great. There you are. Hi. Okay, there you go. All right, so let's wait for her to join up. Connecting, waiting.
Yes, we made it.
Yay, let's go. Now you know.
Now we've got it. Yeah, this is a learning process for me for sure.
I learned this because of Marlene Spence out of Canada. She's the one that got me into this. We originally did this last month, I think it was, or August. And we did all this big series, and I had never done one before. So now you could teach other people.
Yes, I've learned something today. So thank you for that, and thank you for your patience.
Of course. So guys, this is Dr. Dana Cunningham out of Maryland. And again, she is the Vice President for Community Outreach and Engagement at Black Mental Wellness. And we're going to talk about ADHD, what helps and what hurts, and talk about it with children, adolescents, and adults. So that way we can make sure we're making sure everybody gets the hookup with the care that they need. So Dr. Cunningham, let's go right into it, okay, and talk about ADHD. So tell our listeners about what is ADHD exactly. How does it get diagnosed?
So ADHD is a neurological disorder that affects a lot of what we call executive functioning processes in the brain. So we think about attention, concentration, planning, all the things that we want and expect our children and adults to be able to do at work and at school. Many of them are impaired. So there are actually 3 types of ADHD. So even though we use that as an umbrella term, it can look very different. So there's children who are primarily hyperactive impulsive. And so they, as the name would suggest, are very hyperactive, have a difficult time sitting still, might blurt out answers before being called upon. We kind of often sort of describe them as sort of having a motor that's constantly going, kind of constantly talking, interrupting others pretty frequently. And then we also see at the other side of that, the other continuum, students who are young people and adults who are more inattentive. So they have trouble concentrating, may lose things easily, may have trouble remembering things. And then we also see folks that have a combination of both of those symptoms together.
Right, exactly. So if people are looking to see if their child has ADHD, is it a pretty straightforward, easy, oh, they're hyper, they automatically have it? Or what does that look like?
Yes, good question. So, and that is sometimes a challenge for parents of younger kids because a lot of young kids have boundless energy, and they're, a lot of parents may say they're never sitting still. They always want to do something. They must have ADHD. So not necessarily always the case. And so that's why it's important and critical to get a full evaluation for ADHD because unfortunately a lot of kids are misdiagnosed with ADHD that don't have it. So as I was kind of describing some of the symptoms earlier, so sometimes kids that have anxiety disorders often get misdiagnosed because maybe, they are having trouble focusing in class or not getting their homework in. They might seem to get a little anxious in certain situations, may retreat. So that may look somewhat like the inattentive piece of the hyper ADHD. Sometimes kids that have a trauma history often appear as though they might have ADHD with sometimes with hypervigilance or some of the behaviors that we might see in school or at home. And so it's really important to have a comprehensive evaluation where you can rule out or rule in some of those other things. Even learning disabilities sometimes may appear as ADHD when they're not. So making sure there's a really comprehensive evaluation where you're getting information from multiple informants. So not just oftentimes as parents, parents may take their children to the pediatrician for an assessment. And that is an option, but it's also really important to get opinions and reports from people to really make a diagnosis, which is why it's helpful to get information from the school and do some of that additional testing and rule in certain behavioral issues to make sure that the diagnosis is accurate.
Okay, great. And there's some connection stuff, so I may have to ask you to repeat certain things, but I think we got that. So we really want to make sure that when kids are being diagnosed, it is very common for a lot of these families to get assessed just from the pediatrician or the nurse practitioner. And although they can diagnose it, the problem that I find is that many times they're just getting the feedback just from one environment. Or they're not looking at everything else it could be. So my experience, I'm not sure about how you guys, what you see in Maryland, but I notice a lot in Texas, in San Antonio specifically, is that a lot of physicians will give the Vanderbilt. And it's free. It's easy to get. And it's a really great measure because it looks at all the different symptoms. It even looks at some academic stuff, maybe anxiety and depression. And you can ask the teacher and the parent, but it's not looking at everything else it could be.
Right.
And so I think that's where it's limited because maybe they have dyslexia, maybe they have a trauma history, maybe they have anxiety, and it doesn't really go into detail with all those things.
Exactly. Yep. So definitely most important to get that comprehensive evaluation.
Exactly. So I look at it that way too, is that it's more of a rule out diagnosis, right? Because we want to rule everything else out first before we can rule in what it actually is.
Exactly. And there's so much variability, as we talk about the symptoms of ADHD and how it presents. And, two kids that have ADHD present very differently, from one setting to the next, one situation to the next, one person to the next. So it really is critical to get really comprehensive evaluation done.
So one of the things that I often hear too, Dr. Cunningham, is that, I'll talk to a teacher, I'll speak and consult with them, and they're like, well, I don't think this kid has ADHD. Like if the parent brings in a diagnosis, and they say because they're able to read for hours at a time.
Yes.
Or
play video games for hours.
Exactly. They can play video games, whatever, like all these games for long periods of time. They can read Harry Potter, long periods of time. So there's no way they could be ADHD because they can focus just fine.
Right.
What do you say to that?
Yeah. So, for kids that have ADHD, it is more challenging for them when there are things that they're not interested in for them to pay attention to, right? So doing homework, if I don't have any interest at all in science or in math or geometry, that might be much more painful to do or try to get through than reading a Harry Potter novel, which is exciting and enjoyable. And, that's my way to kind of relax and disengage from the world. And so, kids can who have ADHD can sit and play video games for, 5, 6, 8 hours a day, even longer sometimes. But, for them, that's not requiring sustained mental effort. And so when we look at ADHD, we're looking at, we're making that diagnosis, things that require sustained mental effort. If those things are challenging, and that's kind of what we're really looking at.
Right, exactly. And what I also tell parents and teachers is that it's not that they can't pay attention, but they have the inability to regulate that attention, right? So they might be playing video games for hours on end, but they forget to use the bathroom, forget to eat, forget the play date they had scheduled with their bestie. You know, they have all these other things that they totally just missed because they didn't regulate themselves, or they might dysregulate their emotions or their behavior. So they just don't regulate as well as other kids. So yeah, if they're interested in something and they're watching YouTube, they can watch that for hours and focus on it. Yes, exactly. Yes, Marlene, right. Parents say that all the time, and it's like, no, you can't just say it's hit or miss, because if it's interesting to them, even if it looks boring to you, they will stay engaged, right?
Absolutely right. Yep, absolutely right.
So, and what I want to bring up too is then when it comes to adults, because again, ADHD is a hereditary disorder. So if you have a child with ADHD as a parent, you might have it yourself and don't know it, because depending on your age, actually most adults, when you're growing up, many people didn't get diagnosed. You just were that hyper kid, or the kid who couldn't, sit still, or always fidgety, or always busting your head, always going to the ER. You had all these descriptions, but you didn't really get a diagnosis. So if you are an adult with ADHD, you don't necessarily outgrow it, but because your brain is constantly growing, things that might have been challenging for you before, because your brain is now more mature, the symptoms may be less pronounced. And what I've also found too is that things like hyperactivity and impulsivity aren't as significant as in adulthood.
Right.
It gets more tempered, or it might look like restlessness or agitation, where you're in the, if you're a teacher and you're in the teacher meeting and your leg is shaking, or you're always tapping the pen like 50 miles per hour. And so it looks more like restlessness. And then, but the inattentive type tends to persist in adulthood.
Absolutely.
Yeah.
Yeah, and as folks get older, they kind of learn how to accommodate and how to adjust, do whatever they need to do to kind of help get through their day or get tasks accomplished as they get older.
Exactly.
But you're right. Yeah, we usually see a lot of the hyperactive, impulsive symptoms decrease as folks get older, but that inattentiveness oftentimes is still there.
Right. There's a question too. Does that translate over into a child behavior? Are you talking about the restlessness and the agitation? And if so, yes. Because kids with ADHD, they can appear restless and agitated as well. Don't you think?
Yes, absolutely. Yeah. I'm just trying. Yeah, if you could provide some more clarity about the question, that'd be helpful if we didn't answer it. But
then we can answer that for you. The other thing that I found too is that they often call it soft signs for adults with ADHD, are things that you might notice, like, yes, that's what she meant. So yes, the agitation and restlessness, can look like that in kids where they just seem irritable all the time. But that could also be a feature of depression.
Right. That could be a lot of different things, the irritability. Yeah.
Exactly. Right. That's why it's really good to assess and make sure you look at that. But the soft signs for adulthood, what I found is that a lot of adults with ADHD might have a lot of moving violations or speeding tickets.
Oh, yeah.
Because they're not paying attention to the rules of the road, how fast they're going, that there's a cop up ahead, that they're distracted by the radio. So that could be a really big thing. Many times they have a hard time keeping a job because they're forgetting important details like due dates, reading social cues, monitoring their emotions. And then another big one that I find a lot is that they drink caffeinated drinks to regulate themselves. Right? So it's a lot of self-medication. So when they're drinking the Mountain Dews, the Coke, the espresso, instead of feeling hyper, like those of us without ADHD would get, they actually feel chill and relaxed. Because it's a stimulant. So it's stimulating their brain, which then calms them down.
Yeah. And we're seeing a lot more kids starting to do that as well, in terms of, relying on caffeine or other sort of things to try and help monitor and manage some of their symptoms.
Right. Definitely. Okay. So then, Dr. Cunningham, what about some strategies that we can use to support them? So we know that they have ADHD. We've ruled out what it looks like in the classroom or at home. What are some parenting strategies that are effective for these kids?
Yeah, so supporting a child with ADHD, again, what works for one may not work for another. So you kind of have to figure out what works well for your own child. But we do know that generally kids with ADHD need a lot of help with sort of managing, monitoring their behavior. So we really try to look at implementing systems at home. We call it maybe behavior management or behavioral support systems at home and at school to help encourage the behaviors that we want to see more of and try to decrease the behaviors that we're trying to see less of. So what might that look like? So many parents may set up rewards charts for kids if they are able to get certain tasks done. So maybe say if you can, get dressed and brush your teeth and be dressed for school by 8 o'clock, then you get a little trinket, you get a sticker, and as the days progress, as the weeks progress, those stickers or trinkets or tokens can kind of be turned in for other rewards. Other parents may just sort of be more immediate, may kind of set up like just a visual schedule. This is your schedule for the day. This is what we need to do to try to help kids stay on task. Thinking about also really providing how we communicate with kids that have ADHD. So a lot of times we'll help make sure that parents are providing very simple and clear instruction because particularly if you have a child that has difficulty with remembering things and concentrating, sometimes parents will say, go upstairs, brush your teeth, get your shoes, do page 83 of your homework. And then, and so by the time the kid gets upstairs, it's like, I forgot what I was supposed to do up here, but I found here's this video that I really like and want to see. And, next thing you know, they're like on the floor in their room watching a video. Right. And so just being very clear with instruction. And we also want to reward the appropriate behaviors and behaviors we want to see more of. And, I know, sometimes parents and teachers and folks can get pretty creative with ways to try to address ADHD, but, you can't, like, if you make a kid do 20 jumping jacks, it's not going to get rid of the ADHD. It may make them very tired. They may kind of sit down for a little bit. But that ADHD isn't going to go away because of that. So we really, it's not just saying like, I've heard so many kids say, I want to be good. I'm trying to be good, but I just can't. And so helping parents understand that it's not willful disobedience. A lot of times with the behaviors that we see with a lot of kids, they're not doing it on purpose, but are, they just really don't feel like they have any control over their emotions. And so,
right.
Yes. So helping with organization oftentimes can be helpful too. So, making sure that there's a place for homework, right? So that's often a big complaint we have with parents is homework gets done, but it doesn't get turned in to school. So, you go into the book bag and there are like 20 pieces of paper in the book bag that have not been submitted for homework. So coming up with some sort of organizational system to help them is often very effective as well. So that's kind of some things from the parent side. On the school side, there are also some...
Wait, can I stop you 1 second? So I want to make sure we answer this too from Marina is what are some activities that can help them regulate their reactions? So whether it's extracurricular activities or something else. So why don't you talk something, kind of talk about what are some things that would be helpful for these kids, whether it's extracurricular or otherwise, hobbies?
Sure. So with some kids with ADHD do really well and they have, we kind of harness their strengths, right? So if they're tend to be a little more energetic, then maybe getting them involved in some activities where they can release some of that energy. So, whether that might be soccer, sport, tennis, basketball, track, something where they can be pretty active. Some kids also may just need help with social skills. So trying to find opportunities for them to engage in sort of be around positive peers and get some examples from them about how to engage in certain situations.
Yeah.
And I see we have another question here. Have you seen an increased level of lying from children with ADHD? So I wouldn't say increase per se, although
Mm-hmm.
children with ADHD may tend to not tell the truth because, or I'm not saying not tend to, but may more frequently not tell the truth than other children because they're oftentimes getting in trouble for things and
Yeah.
may sometimes feel like, oh God, here we go again. Let me make up,
Mm-hmm.
an excuse or try to come up with a reason for why I just did X, Y, and Z, because sometimes they don't even understand why they just did what they did. And
Mm-hmm.
so as a way to try and, keep from getting in trouble, because they often do tend to get in quite a bit of trouble, there might be lying or exaggeration of the truth or what have you about certain things.
And what I found too is that a lot of times they lie because of the impulsivity.
Mm-hmm.
So it's not a willful, obnoxious, intentional lying. It's that you ask them a question. Did you do your homework? Yeah.
You're right.
And you're like, dude, did you really do your homework? No. So
Right.
when they are given the chance to think about it, then they tell the truth. But they're not trying to lie. And that's what I always try to tell parents is that your kid is not trying to be like the worst kid ever. That is not their goal. It's that they can't often control their experiences. They can't often control the way they react to things. And so when they're really kind of cornered into telling the truth, or when you ask the question that I tell parents, please don't use that, is like, why did you do that?
Oh, yeah.
Why did you trip your brother?
You're going to get a
Why
good
did
answer.
You spill the milk? Right. Why did you? It's like, okay, is any answer they give, will any of it be like legit?
You won't be happy with any of it.
Yeah, and it's like no answer you get is going to meet your satisfaction.
Exactly.
So don't ask those why questions because they probably don't even know why they did it.
Exactly.
So that impulsivity. Thanks, Kim. But it's that they don't even know why they did it. And so you don't want to trap them into lying to you or feeling like, great, like you said, I got in trouble again, so let me make up some story so I don't get punished.
Right, exactly.
Yeah.
Yes. Yeah. common issues there.
Right. What about at school? What can teachers do? Because it's different when you're at home and you have that one-on-one or maybe 2, 3, 4, 5 kids. That's one thing. But when you have a classroom of 20, 30 kids and it's just you or you an assistant, you can't do a lot of this individual stuff. So what should teachers do in that setting?
Yeah. So thinking about other things like preferential seating, right? So where is the child sitting in the class, particularly if they get easily distracted by other things? So are they sitting up front, kind of close to you? Are they sitting near a window, or they might, kind of stare out the window all day? Are they sitting next to positive peers that can, who are serving as good models in terms of, appropriate behavior? Thinking about other ways or other things to do. So if you're getting ready to say something important, like, if particularly for kids that are having trouble paying attention, providing some kind of cue, like, okay, everybody make sure, this is important. Make sure you listen up, right? To make sure that they're on cue. Some teachers may also utilize like proximity control, right? Which is just, if I'm a little bit closer to a particular student, that might kind of alert them that, this is, something they need to pay attention to or try to make sure they're on task. Just providing general reminders and checks. So, students can kind of help each other, check with your neighbor, make sure they wrote down the homework assignment for tonight, right? And then other teachers may do something more individualized for students. So maybe kind of having some sort of homeschool communication system or report card. So maybe there's 3 things that a student has to do on a particular day, or maybe that students are struggling with. So did I bring my homework to school? Was I, able to kind of self-monitor, regulate today? And they may just put a quick check, a smiley face on that sheet, and then that goes home to parents. So one thing that's really critical is for there to be some communication between home and school and collaboration, so that teachers and parents know kind of how to best support each other. Some other things, so we know kids who have ADHD often have difficult time sitting still. it should be okay for them to, can they stand up while they're doing their work? If they're kind of in the back of the class, that's not going to bother anyone. Maybe thinking about some classrooms have stability balls where kids can kind of like an exercise ball, sort of sit and bounce a little bit. Are there sort of quiet trinkets that they can have, they can kind of fiddle with while they're at their desk to kind of just keep them a little bit occupied if they have something to do? Giving students other tasks or making sure, giving them leadership roles in the classroom to make sure they're engaged. But, certainly making sure the instruction is engaging. We know for all students, right? So if kids are going to get bored easily, are there options of things they can do to try to help maintain their engagement in school? Can they have a movement break? That's good for everyone, not just kids with ADHD. Get up and have a 5-minute dance party or, 5-minute meditation or whatever it is, just to kind of incorporate some of that movement into the classroom is really good too.
I love that. And, really being able to, one of the executive functioning skills is self-monitoring. So we want to be able to help teach kids that to read their mind and body so that if you are starting to feel fidgety, before you do something you're going to regret, ask for a break. Or allow them to take a break away from what they're doing where they can go to a tent in the back of the classroom, or they can go to the library area, or they can go ask to speak to the principal or counselor before they get in trouble to work through it. So if you can help them kind of monitor themselves, that could be a good cue for them to know that, okay, I'm starting to get fidgety because this junk is boring. So what can I do to stay engaged, and what can I do to disconnect so that I could reconnect again before I do something I'm going to regret?
Exactly. Being proactive is so important. That's critical. One thing I always say, for parents and teachers, a simple thing, catch them being good, right? Kids get in trouble so much for all sorts of things, whether they have ADHD or not. So whenever you find the opportunity to reinforce those behaviors that you want to see more of, and make sure that they know specifically what they did well, that always will definitely serve you well.
Definitely, because a lot of these kids already feel like they messed up all the time. Yeah. So if you can really have a more strengths-based approach, like we talked about earlier before we joined this live, a more strengths-based approach, that can be very effective as well too, because that way they don't always feel like they're this bad kid.
Exactly.
So what I want to also then address too is from the adult side is that some good strategies to help support yourself. So if you know you're ADHD or you suspect you are, I think it's important to make sure that you, if it's going to help you to get assessed to see where your strengths are, where the areas that you need to improve on, to be able to then look at environments that speak to those things about you. So if you're very fidgety, you need to stay very active. You probably don't want a data entry desk job. That's going to drive you insane. That, maybe doing something that's more active, where you're engaged, where you're using your mind a lot, where you're using all your skills. Those are going to be very important things to keep in mind, because if you're doing something where you're not focused on a job that's based on your strengths or your personality, you're gonna crash and burn very easily. So I always engage and encourage people to get involved in careers that match their personality. Those are people that tend to be happiest in life, is that when they're choosing something that's good for them in terms of their how they function, their temperament. So, again, it might be being a waiter. Some people with ADHD feel like being a waiter is great for them when they're in college, for example, but other people are like, no, because I don't remember nothing. I can't remember the orders. I'm a terrible waiter. But it could be because of that movement. It could be a good thing. So it's, again, knowing yourself and how severe it is for you. And maybe you may not work at a certain restaurant as a waiter, but other types of slower restaurants might be easier for you, for example. So it's about knowing your strengths and making sure you stay engaged with that. Definitely.
Absolutely.
The other thing too, Dr. Cunningham,
go ahead.
The other thing I think is important too for the school system is the whole other health impairment IEP piece.
Yes.
Right?
Yeah, so kids that have ADHD can qualify to get what we call a 504 plan, which allows them to have certain accommodations in school, which is really important. So again, so the parent doesn't have to be alone in trying to figure out how to best support their kids at school. So that 504 plan might help them. So the student might be able to take breaks in class, may have extended time periods for tests, maybe a little extended time for major projects. or allow them to sort of break down big projects into smaller pieces and kind of turn in parts of those projects at a time. So they have to do everything at once. We'll have a plan so that the students can take a break when they need one. And just really be very responsive to what sort of supports that the students need in class. So that is important if your child does have ADHD, to make sure you talk with the school and see what sort of behavioral supports might be in place. So some students, if their ADHD is impacting their educational performance, they can qualify for special education. For students that if they're still performing pretty well in school academically, that's kind of where the 504 plan would come in, because they could still get some support, but they would not be placed in special education classes.
Right. And as long as you have a documented evidence, that's why the assessment is so important, then you can present that to the school, and they are required by law to provide reasonable accommodations if your student is there. Primarily if it's a public school or they're receiving state or federal funds.
Right.
If they're a private or parochial school, they don't have to make accommodations for you. But if a child has ADHD, they are a protected class, just like they would if they had if they're in a wheelchair, or they were had cancer or whatever else, other medical condition. ADHD is a protected condition as well too.
Yep.
So okay, awesome. So then we talked earlier about the strengths-based approach. Yeah. Why don't you tell our followers more about kind of what does that mean and how do we even do that?
Yeah, so I think I would kind of call it the 3 Ps. Be patient, be proactive, and be positive. So Love if we that. Think about that, kids that have ADHD, supporting them the best way we can, it can be very taxing for the adults who are working to support them. So it's important that we are patient, not expecting a quick fix or a quick turnaround. For some kids, behavior therapy works really well. For some kids, they might need medication. For some, it's that combination of both that really serves them very well. And so it's really kind of figuring out what your child needs, but certainly there's going to be rough days. There's going to be days where, instead of oftentimes, some parents use time out for their kids. I tell some parents sometimes they might need to have their own personal time out, right? Just to kind of have some time to debrief, maybe get some support from other parents, maybe join a parent support group. But that it's critical to have that patience, because our children are looking at us. And so we want to be a positive mirror for them in terms of how we deal with stress, how we deal with difficult times. And so making sure that we show that to them is certainly going to be helpful. And then the other P is certainly being proactive. So if we know there's certain situations, there's certain environments that your child may have more difficulty with. So maybe going to the grocery store is a challenge because there's so many things that can pull their attention and pull them away from you. So talking before you go into the grocery store, these are the expectations. This is what, these are the rules. Remember X, Y, and Z that we need to do before we go into the store. And reminding them. So, oftentimes parents get very frustrated. So, I already told them that. You already told them what they need to do. But, our kids that have ADHD need multiple reminders about what they need to do. So it's not just a once and done. It's a constant, often for many of them, constant reminders. And then last, again, I said be positive. So thinking about focusing on the strengths. So a lot of kids that have ADHD have incredible strengths that we can harness. There are, kids with ADHD, they're doing adults and kids with ADHD who are doing all sorts of amazing things. And so not focusing so much on the deficits and what they can't do, but also, bringing into for what it is that they can do and what they can be successful at.
That's great. I love that. And, one of the things that you talked about too is parenting a child with ADHD. How easy, how challenging is it? Yes. For many, it is quite a challenge, and it takes a while to figure out what works. It takes a while to figure out. And as kids get older, as we said before, some symptoms change, and then you have just
teenage adolescents on top of, ADHD and trying to deal with
Yeah.
that. So it's not easy. So they're definitely, the more support you can get for yourself during that process, the better.
Definitely. And I think what I often hear too is when I get calls from adults or especially college students, their biggest thing, the ones with ADHD, is that they felt that they went through elementary and junior high and high school with ADHD and they just got medication, many of them, but they never learned how to cope and how to make it more strength-based. It was always more just medicated. And so they never learned how to regulate. So then they wanted to get off the medication. They felt they were doing better. And then they're in college where there's less structure, right? And so now there's less structure in college. You kind of create your own schedule. You could have hours of free time,
Yes.
and they don't know how to manage it anymore.
Yeah.
And so I think the biggest thing is that you make sure whether you choose to get your kids on medication or you do a more holistic approach with essential oils, with vitamins, with diet, whatever you choose to do, you need to make sure they are educated and they have insight into their diagnosis, what it means, that it's not that they're stupid or that they're unintelligent or that there's something flawed or wrong with them, but that their brain just operates differently.
Yeah.
And then making sure they learn the skills to be successful. Because if not, once they get off the medication, it'll be just as disastrous as it was before because they never learned any new skills. And that's why a lot of times then adults can be successful if they learned effective skills. Otherwise, then they just keep making the same mistakes over and over again. So we want to equip our kids to know how to handle their diagnosis and make it more strengths-based, that this is how your mind has specifically been created. And we can, if there's actually some good things about it, we just got to harness it for good.
Exactly. Yep. Harness it for good.
Exactly.
Yeah.
Is there anything else? Any questions from you guys? Feel free to post your questions in our last few minutes. Is there anything else, Dr. Cunningham, that you think would be important for our listeners to know about ADHD?
There are a ton of resources out there. So there's tons of apps and organizations that have a lot of information out there. So CHAD is one organization that has a lot of support and information. The American Academy of Child and Adolescent Psychiatry has a lot of information. There's also Attitude, ADDITUDE, that is really has tons of research. You can get lost on that website with all of their resources.
They're amazing.
Yes. So definitely you're not alone in the process. There's also some support groups out there as well for parents that can be helpful. Looking at that question.
So Myers-Briggs assessment, is it beneficial for adults? Are there any other assessments that can be used to choose a better career if you have ADHD? Ooh, that's a good question. So the Myers-Briggs is a personality assessment you can take, which tells you if you're introverted or extroverted or intuitive, thinking, judging. That could be a really good assessment in general for your personality, but it's not necessarily going to be a good assessment to see whether or not you have ADHD. If you want to know if you have ADHD as an adult, you really need to do a psychological or a neuropsychological assessment, which then would look at maybe your IQ, your kind of your personality functioning, your processing speed, your working memory, and then ruling out anything else it could be. So assessing for anxiety, for depression, for trauma, any of those kinds of events can look like ADHD and kind of cloud the picture. So it's really good to make sure you get a good clinical interview from a qualified behavioral health professional, as well as getting some objective data as well too, because there'll be some self-report measures where you kind of go across and kind of check yes, no, or true, false, or whatever, and then looking at some objective measures that are standardized too. And so those would be really good, and then that way you can really see where you can go. One occupational assessment that I like is Holland. John Holland, what's it called? Occupational personality assessment. You can get it online, but it's from Out by You at Johns Hopkins, I believe.
Oh,
awesome. And it's basically matching up people's personality with their occupation. And that's a really good one you can get online, and it can show you where your strengths and weaknesses are. But if you want to get a really good, legit one, you should really go to a provider who can assess all of that for you.
Mm-hmm. Yeah.
Yeah. Great question. Any other resources?
So actually on, this might be a good segue to what we want to talk about next. So on Black Mental Wellness website, we also do have some fact sheets about ADHD that also have links to some other resources that they can find there. So is this a good time to kind of transition? I'm not sure.
Yeah, go for it.
Oh, yeah, I didn't realize what time it was. Sorry. A little over 30 minutes. So Black Mental Wellness is, you can find us online at www.blackmentalwellness.com. It's a great website, if I have to say so myself, and it has lots of resources and fact sheets and information on there, some about ADHD, but also about other mental health issues, coping strategies and skills and resources. You can also join us on Facebook and Instagram and help join the movement that way as well. So Black Mental Wellness is an organization that was founded by 5 psychologists to really help promote health and wellness in the Black community. And so we are excited about our platform and some of the things that we're going to be doing in the future.
Awesome. Yes, and one of your founders was one of the people that I trained out here.
Oh, yes, Dr. Crawford,
yeah.
Dana Crawford.
Dr. Crawford, yeah. Right, exactly. That's awesome. I'm glad. I love the work that you guys are doing. It's awesome.
Thank you.
And then, Dr. Cunningham, you also have a book as well.
Yes. So I'm not sure if it'll show here. Is this the right way? Is it upside down or right side up?
It's like backwards, but it's not very clear.
Well, it's
That's okay.
It's called A Day I'll Never Forget. It's a children's book about a young boy whose father is incarcerated. And so it talks about the process of what he goes through from when he finds out to going to school and dealing with it at school, and then actually how he's able to maintain a relationship with his father. So it's a really great book for kids who might be dealing with incarceration, but even if not, just to help increase awareness and decrease the stigma that many kids who experience incarceration may experience. So help kids kind of get a little more in tune about what that might be like for someone who's dealing with, has an incarcerated parent or loved one.
And how can they find the book?
They can find it on Amazon, and it's just A Day I'll Never Forget. You can find it right there.
Terrific.
All right.
Great. So you guys, thanks for joining. Really appreciated the engagement and the questions and everything. If you have any further questions for either of us, you can reach Dr. Dana Cunningham at Black Mental Wellness right here on Instagram. You can also send me questions as well. We're both child psychologists, so either one of us you can reach out to and ask questions. The Instagram Live will be available for the next 24 hours right here on my page at Dr. Ann-Louise Lockhart. And then this Sunday or sooner, I'll upload it to my YouTube page so that you can see it in its entirety if you missed it. So feel free to share it and be able to, again, ask us any further questions. So thank you again. I really appreciate your time.
Yes, this was fun. Thank you.
You're welcome. I enjoy the collaboration. So thank you again.
Me too.
So
we'll have to do it again sometime.
Definitely. Now that we're all like proficient in this.
I know. Now that I know how to get on Instagram Live.
Right. All right, guys. Thanks again for joining us. All right. Bye.